All right. Hi, Dr. Selk. This is Christina Meadows, and this is my audience. I have two people this time. Yay! Okay, and this is my speech. Ready?
Go.
Okay. The title of my speech is called A Merciful End. I would like to take this opportunity to talk to you about a very controversial issue, euthanasia. Through my personal and work experiences, I have become a staunch advocate for the right to die, and I am much more liberal about this issue than most people. The term euthanasia comes from the Greek words eu and thanatos, which combined means well death or dying well. With this in mind, I would like to tell you about my mother, who I recently lost to a terminal illness. I watched her go from a strong, vibrant, independent woman to being tethered to an oxygen tank, losing her mind from disease and medications, unable to perform everyday basic care needs, unable to control her bodily functions, all the while begging and pleading for it to please be over soon. My mother did not die well. If you have ever sat by helplessly while a loved one battled disease or the effects of trauma or the degeneration from old age, you may have wished for a legal, viable option that would allow them to die with dignity. The problem is, in part due to medical advancements, we keep people alive long after they have actually stopped living. Having worked for many years in the medical examiner system in Florida, a state which has a large population of elderly, I have seen firsthand that the terminal and elderly will take matters of ending their pain and suffering into their own hands, often aggressively and violently. According to the Centers for Disease Control, people aged 65 and over account for about 13% of the U.S. population, but 1/4 of all suicides. The elderly, although not terminally ill, do suffer from chronic, often multiple illnesses. In a study done by the Oregon Health Division, the only state in which physician-assisted suicide is legal, the most common reasons given for patients wanting to end their lives were loss of autonomy, decreasing participation in activities, losing control of bodily functions, being a burden to family, friends, and caregivers, and fear of inadequate pain control. An 80-year-old woman who had suffered from breast cancer for 20 years was the first person to take advantage of Oregon's Death with Dignity Act. She stated before her death, "I am looking forward to suicide because as I always was active, I cannot possibly see myself living out 2 more months like this. I will be relieved of all the stress I have." Luckily, this woman had the legal option of physician-assisted suicide. No family member should ever have to go through the horrible experience of discovering their loved one after they have decided to end it all on their own. It should never come to putting a loaded gun to your head and pulling the trigger because that is the only way. I do not stand before you pretending to have the perfect solution because there is no one answer to please everyone. Some people will never consider euthanasia an option due to moral or religious objections. They view any type of euthanasia as murder and as a violation of the sanctity of human life, a life that ultimately belongs to God. I think it is a travesty that our government tells us whether we legally have the right to live or die. In the 1997 Supreme Court case, Washington versus Glucksberg, physician-assisted suicide was rejected as a constitutional right because the right to autonomy clashes with the right to life in our constitutional system. Death is the extinguishment of rights, not the triumph of one right over another. It is highly hypocritical of our government to allow the extinguishment of a life that has yet to begin outside the womb, a life that has no say in the matter of living and dying, and not allow a rational, sane person who has lived a long, fulfilling life the recourse to die with dignity. Pro-choice advocates argue that it is a woman's right to do as she wishes with her body. Why should this right be limited to only pregnant women? If you are lucky, you will never be slapped with the reality of you or a loved one becoming terminally ill or debilitated by old age. We often look at others in that condition and say, I would never want to live that way. But we have more compassion for our pets and animals than we do for fellow human beings. We would not put our pets on life support or let them linger in a persistent vegetative state with no hope of recovery. We would do the humane thing and have them put to sleep. Why is that considered compassionate and merciful for our animals, yet not for ourselves? I concede that this is not an issue with an easy solution, but we have made great strides in the area of living wills and the right to refuse treatment to hasten death. I say we take it one step further to include the right to die when we know it is our time. We would have the opportunity to say goodbye to our friends and family and die peacefully, painlessly, non-violently, and most importantly, with dignity. Thank you.